around the nose, since our skull, the whole skull is a large piece of bone. If it was solid bone, then our skull will become too heavy. Our neck will not be able to support it. So, fortunately, nature has found a solution to that problem by creating large air spaces. So these bones are actually hollow. Most of these bones are hollow. The cranial bone, the upper part is hollow. It houses the brain. And then around the face, around the nose and in and around the face, the bones have air spaces within them. They contain air, and these are called the paranasal or sinuses. Paranasal sinuses are just the sinuses. Sinusitis is infection of these sinuses. All the people who are prone to frequent bouts of nasal inflammation are people who have a high risk of developing sinusitis. Now, this nasal inflammation of the nose, what we call rhinitis, can be either infective, that is a viral infection, or a bacterial infection, which is much less common. About more than 95 to 97% of nasal infections are viral. Less than 3 to 5% are bacterial, actually. Or else, it can even be non-infective, like nasal allergy, what we call allergic rhinitis. Even all these conditions lead to inflammation of the nose. Once the nose gets inflamed, the lining of the nose, that we call the mucosa, it also gets inflamed. It swells up. As it swells up, it tends to block the sinus openings. The sinuses, which I talked about, the air spaces around the nose, in the skull, they all drain into the nasal cavity. They all drain into the nose. Now, if the lining of the nose is inflamed and swollen, then these openings tend to get blocked. Once these openings get blocked, the sinus openings get blocked, then the secretions within the sinuses, they do not get a space to drain out. So they stay within the nose, within the paranasal sinuses. And these secretions, these static secretions, these secretions which stay there, act as a very good culture medium for all kinds of microorganisms, all kinds of bacteria and viruses. These get infected there. That's how we develop sinusitis. Primary method of diagnosing sinusitis is through the symptoms. First, it's very unusual for the patient to have symptoms related to sinusitis without symptoms related to the nose. So there will be symptoms related to the nose, all the kind of symptoms that you have: blockage of nose, watering from the nose, runny nose, sneezing, and other things, loss of smell. So there are symptoms associated with the inflammation of the nose. And then the blockage of the sinuses causes headache. In fact, sinusitis actually does not typically cause headache, which is a common misconception. It is more likely to cause what we call facial pain. That is a feeling of fullness or tightness around the face, on the cheeks, on the forehead, a feeling of fullness, a feeling of heaviness around the face or in the head. When a patient bends forwards, then they may feel something heavy in their head. Or when they snip their nose like this, in the shooting kind of over the into the forehead. So this is these are the symptoms of sinusitis. Then endoscopic examination of the nose. So simple outpatient office procedure. The patient just takes about 10-15 minutes. The patient does not have to get admitted, does not need any special preparations. Patient can just walk into the clinic, get an endoscopy done, and go back home immediately after the procedure. Or else, sometimes you might even need a CT scan. From the nose, the infection travels to the sinuses. Because all the sinuses drain into the nose. Their only opening is in the nose. So anything which enters or leaves the sinus has to enter or leave the nose. So infection of the nose leads to infection of the sinus. Inflammation of the nose leads to inflammation of the sinuses. Now, seasonal changes do not directly affect sinus infections. Seasonal changes can affect certain kind of nasal inflammation, which we call nasal allergies or nasal allergic rhinitis. Now, allergic rhinitis is prone to have seasonal changes. And thus, about 60% of patients with allergic rhinitis have coexisting sinusitis. So whenever the allergic rhinitis flares up, the sinusitis flares up. And this allergic rhinitis may often be seasonal. So that's why, in that way, sinusitis associated with allergic rhinitis may be seasonal, since allergic rhinitis itself is seasonal at times. Treatment of sinusitis is primarily, if it's an infection, then we first try to treat it with antibiotics and nasal decongestants, means something, particular category of drugs which decongest the nose. If that doesn't work, then we'll have to go for an endoscopic surgery. The basic principle of that surgery is use an endoscope, enter the nose, and open up the blocked sinus openings. Take care of nasal infections and nasal allergies, treat them as early as possible. That will prevent sinusitis. That will prevent the blockage of the sinus openings in the nose and thus prevent sinusitis. There are home remedies to prevent sinusitis, but once sinusitis has developed, then it's better to seek professional help. It's better not to try home remedies on that. The main home remedy for prevention of sinusitis would be steam inhalation. The steam enters the nose, condenses in the nasal cavity and the sinuses, liquefies the secretions and helps in draining them. Or else we also use something which we call a nasal douche or a nasal wash, where it's a yogic practice also, I believe, which is called Neti Kriya, where sterile saline is pumped into the nose, into one nasal cavity, and it comes out to the other nasal cavity. It actually washes the nose, and then it's repeated on the other side. That is another home remedy which can help in prevent or treat early stages of sinusitis. But once full-blown sinusitis has developed, then it's better to seek professional help.